Today we're going to discuss motioning of the spine. Motioning is a chiropractic technique that is used for diagnostics and oftentimes therapeutics that will help some of our spines that are just kind of tight and trying to help get release. Motioning is mostly, it helps us to localize where problems are, where pain can be, where muscle twitching is. But oftentimes just going through the spine helps loosen things up in terms of vertebral fixation. But it's important because that we don't push too hard. It's something that you have to be careful with. As far as amount of pressure you put on this, I've already told you it's something that has to be done very lightly. They talk about the pressure should be this amount of pressure you'd apply to your eyeball if you were pushing. We're not pushing any harder than that. We don't have, all we need is very small movement at these vertebral joints. So it's also something that should be done with a dog that's a little warmed up. We wouldn't just take a dog who just woke up and start going up and down his spine here too. It also just needs to be done typically once or twice. This is not something we do over and over again on a particular session. So we're going to show you how to do this on a dog and a cat, and we'll show you anatomy on the spine too. And hopefully this will help you to help your pet. Okay, so first some anatomy lessons. We have our spine, we have our cervical spine, the neck comes down, then we have our thoracic spine. The thoracic spine is where the ribs are. So thoracic spine is typically quite rigid compared with a lumbar spine, which is quite flexible. So oftentimes we'll have problems right where the two meet. It's kind of the hinge area where the thoracic spine meets the lumbar spine. And then another very common spot is where the lumbar spine meets the sacrum of the pelvis. So these are landmarks that I'm going to that are important to kind of learn as we go. The first landmarks are the pelvic, the wings of the pelvis. These are called the ilial wings, and you'll find them on patients. Back on the back quarters, there'll be the two big knobs. If you're feeling back over the pelvis and you feel two big knobs on either side, that's where you are. You're on the ilial wings here. And so right in between there is where the lumbar spine meets the sacrum. This is the sacrum, tail comes off from here. So this is the sacro, and this is the ilium. So sacroiliac joint and the lumbosacral joint. So oftentimes that's where we will be starting our motioning. The other important thing to pick up here is that most spines, all spines, have a straight, but they have a dip in the spine. And you can kind of see here that dip, my orientation changes, how things are straight up and down here, and now that we're at kind of a 45-degree angle. So if we're motioning above this little dip, which is the 10th thoracic vertebra, then our motioning is going to change. So that's an important landmark too. So typically motioning, what we're going to do is we're going to take the base of our thumb, it's called the thenar part of our thumb, which is kind of the base of the bone right here, and we're going to be bouncing on the tops of the vertebra. This is, so as opposed to we're not poking, we're just kind of gently bouncing, and what our goal is here is we're just moving a little bit these joints right here. That's all we're trying to do, is just a little bit of motion and loosening up the joints. So that is perpendicular to the spine up into that dip in the spine. Then so we're going perpendicular. Once we hit that dip, now we're going to go at a 45-degree angle. Instead of straight up and down, we're going to go at a 45-degree angle forward and doing a little bit of motioning that way instead of straight up and down. So we'll show you that on an animal, but that's basically what we're doing. We start between the ilial wings. That's where we start, and that typically feels good, people or animals. It's our tailbone, it's where everything comes together. And we'll do a couple bounces on the tops of each vertebra as we're coming down, and then change at the what's called the anticlinal vertebra there. Okay, so we have Mario as our example here today, because he's so easy to kind of see our anatomy on, as opposed to most dogs that I see that are kind of overweight, and that's why we have kind of problems that start up. So as we were saying, what I usually we'll usually start back end with this. We find our pelvic wings, our ilial wings, and there are two big knobs that are right back in that area. And typically, if you just kind of come around an animal's thighs and come up, your thumbs are going to be right on those pelvic wings. So that's where we start, right in between there. When we're motioning, then what we're doing is we're going to support from underneath, so we're not pushing down without anything underneath. We don't want to be pushing down them at all, even as soft as it's going to be, without some underlying support. And then Mario's, we were talking about this dip in the spine. There is his dip. It's obvious. Typically, if you just roll down, you'll roll off the withers right into kind of that dip area. So that's where our orientation would change to where we're going forward. So, but that's the 10th or 11th thoracic vertebrae. And then I have 12, 13, and this is where, here's the end of my rib cage. You can see where that comes together here too. That's your other way of finding that out. So we're going to take the pelvic wings. We're going to start there. We're going to support from underneath. Mario's been out for a walk, so he's moved around a little bit, so we're warmed up. And then this is just a couple little bounces on each. On Mario, it's easy. It's easy to feel the individual vertebrae, the tops of them. So just some gentle little bouncing there. And when I reach my dip, which is right here, now I'm going to be pushing a little forward, and instead of straight up and down, we're going to be going a little bit forward from there. And that bothers Mario just a little bit right in there. Now, that's why it's a diagnostic tool too. If you have pain, if you pick up pain, don't do this. This is more for kind of for working out physical therapy after we've been through problems and diagnosed. But I don't want you causing any pain, and if there is any pain, I don't want you working in an area like that too. This is meant to increase flexibility for us. Cats are usually, well, they either like it or they don't. Lots of times cats who have really sore back ends don't appreciate you rubbing back there, but then a lot of cats, if you've ever noticed, they really like you to be rubbing over that pelvic area, like Benny does here. So it's the same kind of thing. I will find my two knobs here. I find my pelvis. Now, the other part about a cat, like a dog, you can kind of keep them straight. Cats are going to kind of roll around on you a little bit, and so with a cat, I'll find that spot. I will start there. The important thing to remember is I want to stay perpendicular to the lumbar spine. So if he's moving one side or another, we can still do the motioning, but you need to stay perpendicular to the spine. So here's his pelvis, so I'm going to start right behind there. I don't have to support with a cat underneath. I don't have to support because the ground is supporting him. So that's fine. And I just kind of slowly going to work my way up that spine. More cats is just sitting still is the harder part with the kitties. But I will also, same kind of thing, I'll find that spot where the transition occurs, and that's where I would that's where I'm going to kind of go to a 45-degree angle. So here, Benny, let's do that one more time, just kind of show people. So I start between those pelvic wings, work our way up. He turns, I just go with it. With cats, you go with what they'll give you. And you can even do it really with a cat or a dog with them lying on their side. I mean, if they're lying on their side, then just, again, stay perpendicular to the spine as you do it.